Hi student, I will complete the next part of the lecture about sickle cell disease. So as I explained before, in the sickle cell disease there will be abnormal in the red blood cells. So there will be abnormal erythrocyte, and normally it is rigid and sickle shape, and because of its shape it is adhered to the endothelium of the blood vessels and causing obstructions and reduction in the blood flow, and by that it will be end by ischemia and infraction. So it's very important to understand the shape of the red blood cells causes it will stuck in the blood vessels, and it will cause obstruction and lead to the ischemia. And from its shape, sickle shape, it's called sickle cell disease. So you have to understand that exposure to the cold aggravate sickling process, and also you have to understand that oxygen can be impaired also due to the viscosity of the blood. So for example, it's very important to understand that a sickle cell also have a short lifespan, for example from 10 to 20 days. It is, for example, that the normal red blood cells have it's have around 90 days. Here we have 10 to 20 days. So all of these symptoms lead to the development of anemia, and I will explain the next slide what we mean by here oxygen can be impaired by the viscosity of the blood. For example, here you will have normal red blood cells. For example, here this is normal red blood cells. It's the shape is normal, and but however here we have abnormal blood cells. Here we have sickle shape, and also because it is sticky, so it will lead to the it will lead to this to be stuck in the, also because of its shape it is stuck in the blood vessels and causes ischemia, and also because it is also sticky sickle cell. So this is some of the pathophysiology of the sickle cell disease. So clinical manifestation, it's normally the clinical manifestation of the patient who has sickle cell disease. It will be normally near to the clinical manifestation of patient who have general anemia. However, you have to understand, may we have some different manifestation. So for example, the patient will develop jaundice, and the patient will develop also his pallors, and also the the hemoglobin will be low. For example, from 7 to 10, and also face and skull bone enlargement. Why? Because this is because the patient developed this because of, of the excessive production of the RBC. The RBC are produced but are destroyed. As we say that there is destruction in the RBC, so because of that it is considered under type of the hemolytic anemia. And the patient will have tachycardia, cardiac murmurs, cardiomegaly, because the patient all time has low hemoglobin, so they have low cardiac output, and the heart is working as maximum level to try to to provide tissue perfusion, and because of that the patient have tachycardia, develop tachycardia, and develop cardiomegaly. And the patient sometimes also has a pain, abdominal pain and bone pain, and because of the of the anemia and the affecting of other organ like a spleen or liver, and because of the excessive production of the RBC due to the destruction of the RBC. And the patient also could develop infection because the blood cells, the shape of the blood vessels is a stick in the blood vessels and causes infection. And also the patient may develop decreased vision. Why? Because also remember that all time that the shape of the of the blood blood cells are it's stuck in the blood vessels, and sometimes causes many problem to the other organ. And also the patient may will have skin ulcers. Also, clinical manifestation, you have to know the patient with the sickle cell crisis, or may the patient will have acute vaso-occlusive crisis. As I explained, because that sickle cells stuck in the blood vessels, it could causes hypoxia and very painful, and it is called acute vaso-occlusive crisis. And the patient also will develop a plastic crisis, and in this case the patient will have infection because of the virus, and patient will have rapid reduction in the hemoglobin. So this is some of the acute chest syndrome. When the patient develop acute chest syndrome, it's very important. One of the very important things you have to understand with the patient with the sickle cell disease, that you have to be you have to understand that patient with the sickle cell disease develop acute chest syndrome. So it's because of that these sickle cell disease is one of the critical condition. And as I said, the chest syndrome, because that it is occlude the blood vessels, and due to the pulmonary infarct, a thromboembolism, or infection. And symptoms: patient may will have chest pain, patient will have fever, respiratory distress, patient will have tachypnea, patient will have cough, respiratory infiltrate. All of these because of the occlusion, due to the occlusion, thromboembolism, whatever it is in the heart, whatever it is in the sometimes in the respiratory. And also the treatment, it's very important to start antimicrobial antibiotics, blood transfusion, and bronchodilator. Sometimes patient may in severe condition may need mechanical ventilation and intubation. It's very important in this slide to understand that that the sickle cell disease is common in Oman, and because of that it's very important to understand the pathophysiology and nursing management and intervention when you care with for the patient with the sickle cell disease. And here, medical management, it's very important that there are different type of the medical management of patient with the sickle cell disease. May will start vasodilator, at least, will try to, vasodilator will try to, to increase tissue perfusion, and also sometimes they use hydroxyurea, and this is they have some significant result in decrease the formation of the sickle cell and reduce the pain episodes, but however it have some many side effect. And also the patient may with the sickle cell disease need blood transfusion, and it's very important when the patient receive blood transfusion to risk for the iron overload, and the patient may need coagulation therapy and keep the hemoglobin less than 11, and also exchange transfusion. Maybe patient needs sometimes exchange transfusion, like we take the blood of the patient and we give the sometimes exchange blood. And also other things also you have to the patient with the one of the management of the patient with the sickle cell disease is daily folic acid supplement. So it's very important that patient take daily folic acid to at least we make sure that to maintain the hemoglobin. So also there are some of the medical management, as I explained here, some medical management, supportive therapy, it is pain management. So normally patients with the sickle cell disease, they come to the hospital because of they are having severe pain. The pain is common lower and upper extremities, knee, and sometimes in the back. And severity of pain is very, as I said, it is very severe, and sometimes it's more than cancer pain. And for example, the patient may receive aspirin. Why? Because it is effective to relieve the mild to moderate pain and also decrease inflammation and prevent thrombus, because as we said, the patient may develop the blood cells, the RBC is occluding the blood vessels, and also sometimes causing thrombus. And also non-steroidal anti-inflammatory drug with combination with the opioid analgesia sometimes will be effective, and especially sometimes the patient, if you see when you will be posted in the emergency department, you will see that morphine is the medication of the choice to treat the acute pain in patient with the sickle cell disease. Now this is some of the study, you can read it, which is in 2017, which is indicate the benefit of the using hydroxyurea to reduce the pain episode and reduce the sickle cell disease in patient and his symptoms. You can read this one. And now this is the quiz, you can also read it, for example, and this is the answer is there. And now I will move to the other part about the nursing progress in the management of patient with the sickling anemia. For example, here you have to know, this is some of the nursing diagnosis which is very important to understand, that patient will have acute pain related to the fatigue and fatigue related to the tissue hypoxia. It's very important to understand the causes of the pain in patient with the sickle cell disease because tissue hypoxia, and I explained the tissue hypoxia because of the low hemoglobin, and also because that RBC is obstructing the blood vessels, and also the patient may has risk for develop infections also, and the patient has risk for develop powerlessness and also hopelessness. It's very important to assess this patient and provide psychological support for this patient. And the patient may have lack of knowledge regarding the sickle cell crisis prevention. It's very important to educate the patient about how to reduce the factor, how to know the factor which is increase the condition, and what other factor which is reduce the condition of the sickle cell disease, I mean the symptoms. So the nursing intervention, it's very important also to know to manage the pain and fatigue in the patient. For example, you have to assess the pain, the pain of the patient, and for example, based in the pain scale, you have to guide the use of the analgesia. And also, for example, you have to use non-pharmacological pain management with this patient, at least because we don't want patient to have all time in analgesic or opioid, because this could lead to the addictions. So at least you use non-pharmacological pain management, so help the patient to reduce his pain. And hydration therapy is one of the important things, that to hydrate the patient, because one of the risk factors which is increase the sickle cell symptoms and crisis is dehydration. So it's very important to hydrate the patient and educate the patient about hydration and balance between activity and rest, because as we explained before, that anemia need balance between activity and rest. And assist the patient to find strategies to cope with the daily life demands. It's very important. Sometimes, as I explained, the patient maybe it'll be helplessness or hopelessness, and it's very important because of this. It is a hereditary disease, and it is the patient has to cope with his life demand, and also maximize nutritional healthy sleep cycle, and reducing the tissue hypoxia. So these things is very important to know. Preventing and managing infection, it's very important to assess for the sign of infection. It's very important to start antibiotic, and it's very important also to educate the patient to complete the course of the antibiotic. And it's very important to provide the patient with the with adequate knowledge and about this disease. And also, and it's as I said, for example, it's about keeping warm and increase hydration. This is one of the important things. So because I explained in the beginning that cold temperatures may aggravate the symptoms. And this is the end of the lecture. And if you have any question, you can you email me.